So the treatment of patients with advanced stage diffuse large B-cell lymphoma hasn't changed in almost 4 decades, with the exception of rituximab, which was added about almost 15, 20 years ago. So the expected outcome for frontline regimens is that we cure about 60, maybe 65% of the patients. For those who are not cured with frontline regimens or relapse after frontline regimens, the standard of care right now is autologous transplant. But in the era of rituximab-based therapy, the benefit from autologous transplant has almost reduced by half. So that tells us that we need something new, effective, to help patients who don't respond to frontline therapy or relapse from autologous transplant or don't benefit from transplant. For this patient population, who fail frontline and second-line therapy, the survival is really poor. The average survival rarely exceeds 1 year, which is miserable. There's not a single agent approved by the FDA for these patients with relapsed large lymphoma, in more than 4 decades. And that's where the excitement about CAR T cells. Now we're seeing cell therapy, which is new to all of us, producing up to 80% response rate, which is unheard of. We never saw 80% response rate with any agent, despite all the agents being tested over the last 4 decades. And the complete response rate, CR rate, close to 50% in these patients who failed frontline and sometimes autologous transplant. And I think that's why it is generating a lot of excitement. That's why the first drug got breakthrough, got approved based on phase 2 non-randomized trial, and hopefully additional cell therapy will be approved for the same indication.